Hi, I'm Dr. Kit Weathers, and it's time for the Root Tip of the Week. Today's magic trick involves a box of crayons and a little child, or a big child, doesn't really matter. But my problem is I don't have either one of those today to demonstrate. So what I'm going to do is we're going to use this box of playing cards, which is roughly the same size as a box of crayons, and you can't see inside of it. So we're going to tell people that it is possible using X-ray vision to look inside this box and see what color crayon has been selected. So what you do is you have someone pick one of the crayons out of the box, and just for our purposes of illustration, we're going to pretend like it's purple. I'll use this little cap off my pen, and they take all of the crayons out of the box except the one that's inside, and without being able to look inside the box, you will turn your back. The person will hand you the box behind your back. When you turn around, you're going to bring the box out, and just by holding it up like this, you're going to tell what color crayon is left in the box. Now, the secret is really very simple. To learn the secret to this and other magic tricks in this series, go to EndoRootCamp.com. Today's root tip concerns the closed mouth Akinosi technique. We're going to go deep in, no, not Akinosi, Akinosi. And we're going to go down the corridor with the patient's teeth together for a closed mouth high block technique. I think you're going to enjoy this one, so let's go inside and take a look at the Akinosi technique. Some mouths are a lot smaller than others. Some are quite large and easy to get into. Like this guy, for example. Plenty of room there. We can easily get in and do what we need to do in this mouth, but not everybody's going to be that cooperative, so let's take a close look at why, some of the reasons we might want to use the Akinosi technique. The first time I ever used the Akinosi injection was on my dental assistant's husband, who had a fractured jaw, and in order to get the tooth numb, we had to go in and use the Akinosi down in the buccal corridor, but then I was able to make my access opening right on the buccal portion of the lower bicuspid, bend my files, get into the canal, and go ahead and do the root canal. One other time that I used the Akinosi was a patient that came in, had a little kid bitten by a dog. Not this guy, of course, but he was crying, his teeth were crunched together, and he just wouldn't open his mouth. So I went ahead and just pulled the tissue back, put a few drops in there, gave the Akinosi injection, and it stopped the pain almost immediately, and then the child let me go ahead and sew up the bite from the dog. Now, the reason we call this a high block is the standard Halsted injection, we enter the jaw right in this area right here, but with the Gau-Gates, we go up more like at this area around the neck, and the Akinosi is somewhere in this area. Now, why is that important? What kind of advantages do we get? Let's take a close look at the injection site. With the Akinosi injection, we're going to go pretty much parallel to the necks of the teeth, and we're going to go back about 2/3 of the way on the mandible, and you can palpate the distance between the front and the back part of the mandible. We call it the ascending ramus and the back part of the mandible. And then you'll go about 2/3 of the way down and inject. The problem with Akinosi, of course, is you don't have a bony stop like you would with the standard Halsted injection. However, even though this has slightly less success rate, it is a very, very valuable injection, and I think you're going to enjoy including this in your practice. Okay, let's look at the advantages of the Akinosi injection. It numbs the motor nerves to the facial muscles and relaxes the muscles of mastication, so patients can open wider and easier. It's easier to administer and certainly more reliable than the standard Halsted injection. More comfortable for the patient because the teeth are loosely together. Not a bad idea if the patient's teeth aren't wired to put a couple of cotton rolls in the mouth so they can close gently and not clench down so they don't tighten up the muscles, making it difficult for you to inject. Works even if the teeth aren't wired together. It's great for patients who have trismus or limited opening. You don't have to fight the tongue and the cheeks all the time with the teeth together. It's virtually painless because you only have to penetrate approximately 1/3 the length of a long needle into loose, spongy tissue. And finally, it numbs the accessory nerves, the lingual nerve, and the long buccal nerve. With the Akinosi injection, you're going to get the nerves before they branch off, the accessory nerves, the lingual nerve, and the long buccal nerve. And we all know that the long buccal can be a very painful injection. It's going to be much more predictable, easier to administer. You don't have to fight the teeth, the tongue, the cheeks, and everything inside the mouth. So just give it a try. I think you might enjoy adding this to your armamentarium. Well, that's it for another Root Tip of the Week. I'm Dr. Kit Weathers, inviting you to join me at our very next Root Camp. So long for now.